Greetings and welcome to the Alpha Omega Alpha Annual Induction Ceremony. My name is Vineet Arora, and I'm the Dean for Medical Education at the University of Chicago Pritzker School of Medicine. Tonight, we are here to honor the 18 students from the Pritzker School of Medicine class of 2022 who have been selected to get inducted into our Alpha Omega Alpha Honor Medical Society, in addition to the alumni, faculty, and residents who will also be honored. You'll hear more about that in a moment. I also want to start out, before we begin, by just acknowledging how grateful we are that we are able to gather in person for this special event and this special occasion. Gathering in person is not something we take for granted. We know it's been brought to us because of the science of both mitigation and vaccination, which we hold near and dear. We're grateful to the University of Chicago to enable us to host this event in this historic building and also invite guests to join us not only here in person, but also on the live stream at home. I know that this has been a long haul for many of our students who have trained almost exclusively during a pandemic, so I'm so pleased to be able to honor all of you in person tonight. Tonight, we are also thrilled to be joined by our Dean for the Division of Biological Sciences for the Pritzker School of Medicine, as well as the President of the University of Chicago Medicine Health System, among many other titles, Dr. Ken Polonsky. I would like to invite Dr. Polonsky at this time to say a few words.
So thank you, Vinny, and welcome everyone. It is really a pleasure to be here. This is always a very special occasion, this event, and it's particularly special, as Vinny has said, because we can meet in person, and I'm really delighted to congratulate everybody who has been recognized tonight. So obviously it's students, alumni, faculty, residents, and it's particularly wonderful to have family members here, friends, and also I'm sure on live stream. So I think what we recognize is that what we're acknowledging this evening is not just academic accomplishment, but the broader roles of physicians and of medicine, professionalism, ethical behavior, doing the right thing, taking care of people in need. And these are obviously values that we hold very dear, and it's always wonderful to recognize people who are at the top of the game when it comes to all of these broader aspects of medicine. So thank you all for being here. Congratulations, and it's wonderful to be able to celebrate with all of you, and I look forward to a wonderful event. Thank you.
Thank you, Dr. Polonsky. Before we go on, I did want to just recap our wonderful day today with our visiting speaker, Dr. Kimberly Manning from Emory University, Professor of Medicine, as well as Associate Vice Chair for Diversity, Equity, and Inclusion there in the Department of Medicine, who served as our Alpha Omega Alpha Visiting Professor. For those at home, she joined us virtually today for a series of meetings, including Resident Morning Report, where she was presented a clinical unknown, so really hearkening back to those traditional visiting professorships, and then gave a brand new talk for us called The Space Between, a narrative journey through the hidden curriculum. And I can truly say that Dr. Manning embodied for us and inspired us to achieve what Alpha Omega Alpha really stands for, which is to be worthy to serve the suffering. So at this time, I would like to acknowledge Dr. Manning, who of course couldn't be here with us in person, but sends her regards and was so grateful for all of you, and she did have a lot of fun while she was here with us virtually. So a round of applause for Dr. Manning. So as is the case with many of our events and activities at the Pritzker School of Medicine, it would not happen without dedicated faculty advisors. And I'm very pleased now to introduce Dr. Dan Golden, who is an associate professor of radiation and cellular oncology and serves in the role of our AOA counselor. He's been working with our students over the past several months on preparing for tonight's events. And I don't need to tell you how hard that is in the time of COVID to be preparing for any event. And so a special shout out to not only Dr. Golden, but our entire student affairs team who's sitting in the back who have been supporting him as well. And so Dr. Golden.
Great. Thank you very much, Dr. Aurora. Well, congratulations to everybody. This is a great event, and it's exciting. I just wanted to start by kind of telling you what Alpha Omega Alpha says that they stand for. So AOA, or Alpha Omega Alpha, is dedicated to the belief that in the profession of medicine will improve care for all by recognizing high educational achievement, honoring gifted teaching, encouraging the development of leaders in academia and the community, supporting the ideals of humanism, and promoting service to others. And I think everyone here tonight really exemplifies what Alpha Omega Alpha is trying to do. Just brief history, you may not know, but the Honor Society was actually founded just up the road at what used to be the Chicago College of Physicians and Surgeons in 1902. It's now the University of Illinois College of Medicine. And this chapter was founded, I believe, 2 years later. It's the Beta chapter of Illinois. So this is quite an old honor society, and it's now all over the world. There's, I believe, over 200,000 inductees, and it's at about 200 institutions in the U.S. and several others around the world. So I think without further ado, we'll move forward with the induction. I'm looking for the notes. I will say Dr. Manning had all of the students introduce themselves when we talked to her, and they had the opportunity to say how they like their name pronounced, specifically how they like their name pronounced. And I have no excuse to mispronounce your name tonight, and I still will probably mispronounce a few names, so I apologize in advance. I was taking notes, like seriously. So let me pull up just to go over the instructions, make sure I get this correct. So I apologize. My printer in my office wasn't working. It's probably the first time I tried to print since February of 2020. So, all right. So I will call each student up individually. We have Dr. Aurora with us already. I ask that you hold your applause until all of the students have been called. As your name is called, Dr. Aurora will be presenting you with a framed certificate. Let's see, I've conflicting, and then, so yeah, hold your applause until the end. Thank you. And then you can return to your seat after you receive your certificate. So I will call everybody up in alphabetical order. So we have Daniel On. Catherine Brito. Risa Bredney. Daniel Kamashu. Rahul Dadwani. Jorge Luis de Avila. Brianna Farley. Susan Felt. Shira Fishbach. Namrata Garg. Noam Margalit. Tyler McSannick. Darlington Woodoo. Cody Sane. Olivia Schultz. Russell Simons. Helen Way. And Allison Yee. All right, and now I know you've all been holding your applause. Now we can applaud. So. All right, and I've had the privilege also of getting to know all of you a little bit through the AOA process over the last few months. I don't work directly with students a ton, so it's really been a treat to get to know everybody, and I'm sure you'll all do amazing things as you go forward, so congratulations again. So the students also, after they're selected, they have the opportunity to elect alumni, faculty, residents as, or house staff, could be residents or fellows, as members of the society, and then they also select a volunteer clinical faculty to receive an award for their contributions to education. So we're going to have students introduce those honorees tonight. So we'll start with Daniel Kamashu, who will introduce Dr. Robert Gusi.
It's my distinct privilege to introduce you to Dr. Robert Gusi, our Pritzker alumnus honoree for this year. I first met Dr. Gusi in 2015 when he returned to the University of Chicago as an assistant professor in the pulmonary section. At that time, I was conducting pulmonary research and got to know Dr. Gusi's research program, which focuses on the mechanisms of acute lung injury, repair, and fibrosis. However, it wasn't until the summer of 2021 when I rotated on the pulmonary consult service and worked with Dr. Gusi in a clinical setting, that I understood the balance of his research endeavors with clinic time on service and in the outpatient clinics. Dr. Gusi stands out as a devoted educator of patients and team members. In the presence of his patients, he centers the encounter around their concerns and has a carefully attuned thermostat for whether those concerns are meaningfully addressed. He's an expert navigator of difficult conversations, for example, on the topics of COVID vaccine hesitancy and diagnostic uncertainty. In the eyes of team members, he's seen as an exceptional educator, and he fostered a sense of engagement on a team of trainees entering very diverse areas of medicine. In these ways, Dr. Gusi is a role model as an alumnus. He is the type of physician, educator, and scientist I hope to become. Congratulations, Dr. Gusi, on this well-deserved award.
So, wow, Dan, thanks. I was asked to prepare something to say. I honestly don't have much to say after that introduction. I really want to thank not only Dan, but the students of the class of 22 for this honor. I was, to be honest, a bit shocked, humbled, and just really grateful I've been nominated and selected. This is a big deal. As you might imagine, being an alumni honoree means that this wasn't something I was selected for as a student. So again, it's a really great pleasure. I did want to say a little bit about working with students during my clinical role. As Dan alluded to, I spend about a quarter of my time seeing patients in the hospital and in clinic, both on the consult service, but also in the lung transplant service, where I spend most of my time. And having Pritzker students on the rotation has always just been a distinct pleasure, not only because of what they add to the team, and we really think of you all as part of the team, and I genuinely mean that, but also what that allows me and other physicians to be able to do during service, because you may not realize this, but on the lung transplant service, for example, or on the consult service, we see transplant patients every day, all the day. And after a while, you start to forget how really special it is what we do, and really how amazing it is that we're able to take a patient who maybe has 6 months or a year to live, and with medications and surgery that really didn't exist 20, 30 years ago, we give them a new lease on life. And with that comes not only the highest of highs, but the lowest of lows, because as you not only may have already experienced, but soon will experience, not everything always goes as planned. And really, I think being able to be part of a team and really build that relationship with patients really helps when, it's great when the highs are high, because everyone can celebrate. But when the lows are low, having built that relationship really pays off, and it really helps. And so with that, not only am I grateful to have had the pleasure of teaching students on the consult service, but also with the new interprofessional clerkship, having patients, or not having Pritzker students being able to experience the teams that are involved in patient care, I think has really been a great addition to the curriculum. And I want to applaud Dr. Rohr and the curriculum committee for building that into the third year and fourth year experience. The last thing I want to say is, I think in retrospect, I can pretty confidently say that the education that y'all received here in Pritzker really will pay off dividends, not just for the next step in your training, which whether it be residency or some other part of your career, but let's be honest, we think we know what's going to happen in 5 years. We think we know what's going to happen 10 years from now, but we don't. Things change. I've had the great pleasure of being able to build a laboratory and perform research in the lab and translational work. And that evolves over time. And really the training that you get in medical school, and in my case, the MSTP program, really not only builds for the next step, but whatever comes beyond that, whether you know what's coming or not. And so with that, I just want to thank you again for the privilege and the honor of this award. And congratulations on your upcoming graduation, and good luck on the match in about 3 weeks.
Let me see. Do we have the notes up here? Did you put? Oh, let me see. Sorry. All right. Whoops. So next up, we will have Daniel on introducing Dr. Milda Saunders, one of the faculty honorees. Unfortunately, our other faculty honoree could not join us tonight, Dr. Stephen Estime. So I'll turn it over to Daniel.
I have the distinct honor and privilege of introducing Dr. Milda Saunders, Interim Associate Dean for Health Equity, Diversity, and Inclusion at the Pritzker School of Medicine, Associate Professor of Medicine, and my exceptional research mentor for the past 4 years. When I look back at my time at Pritzker, I cannot think of a person who exemplifies excellence in mentorship, leadership, care, and research on health disparities in such a way that Dr. Saunders does. Her dedication to and success in improving care for and knowledge of kidney disease, which disproportionately affects African American patients, is a prime example of what the place like the University of Chicago should strive towards in improving health care of our surrounding community. While I'm going to become a surgeon, her mentorship and work will continue to be sources of inspiration as I aim to address disparities in kidney disease in my future career too. Aside from her leadership, research, and clinical care, what really stands out to me is how she has helped me grow as an individual. She may not know this, but her steadfast support and provision of a safe space for me to explore my identity as an Asian American in medicine and my interest in mentoring high school-aged youth have made me feel very welcomed in an environment such as medical school that can be very challenging and isolating. Her thoughtful and purposeful mentorship inspires me to do the same. Not just for me, though. Her current role as a leader of our Office of HEDI and her strong presence within our administration have allowed all of my classmates to view her as a role model as we all aim to become physicians who are cognizant of barriers and injustices that prevent delivery of equitable care. In all, I feel extremely privileged to announce her as an AOA faculty member, an honor that everyone would agree is long overdue.
Okay. So, thanks, Daniel. That was amazing, and I'm humbled by that. So I'm so honored to be an AOA faculty inductee. I want to thank those who nominated me and who selected me. I'm humbled to join such an esteemed group of students and faculty honorees, and both past and present. And as Pritzker and AOA move to honor not just excellence, but inclusive excellence. I'm appreciative that I've been able to take part in that journey. And so those who know me, including Daniel, know that I'm often a few minutes late, or maybe working at the last minute, as evidenced by my scribblings on this sheet of paper. And so for those of you who are being honored today, congratulations, you are fantastic and amazing, and I can't wait to welcome you as my future colleagues. But for those of you who are not in this room today, I want to let you on a secret. I was not AOA, and I still feel like I'm doing okay. And so for us late bloomers, do not be afraid of growing slowly. Only be afraid of standing still. But for you, congratulations.
All right, and now we have our house staff honorees. We will start with, I don't have, oh, here we go, sorry. Aisha Amuda, Dr. Aisha Amuda, who will be introduced by Cody Sane.
On behalf of the entire AOA class, I'd like to introduce Aisha Amuda as a 2022 AOA House Staff honoree. While many students have had a chance to work with Dr. Amuda during their third-year pediatric or internal medicine rotation, I was lucky enough to work with her on both. As a then PGY1, Aisha's care for her patients was impressive. She demonstrates a natural ability to empathetically navigate patient conversations while simultaneously being a leader on our teams. With every patient we cared for, Aisha was always found a unique way to advocate for our patients' best interests and express nuances in patient care that are often overlooked in a busy clinical setting. Beyond that, she is a generous teacher who prioritizes the learning and well-being of the students on her team. In doing so, Aisha made each of us, regardless of our respective roles, feel like crucial members of her team while consistently fostering our growth and development. However, what sets Aisha apart is her generosity and the warmth that she takes with her everywhere she goes. From hanging pictures of Black Panther in the workroom for motivation, to discussing the latest news and releases from Beyonce, to enjoying the latest Adele album at a remarkable listening party. Aisha naturally creates welcoming spaces in her life and brings that same joy with her to work each and every day. You are a true role model for us all, Dr. Amuda. Thank you and congratulations on this most deserved honor.
Thank you so much, Cody, and thank you so much to the 2022 Pritzker inductees to AOA. For me, some of my most memorable experiences as a medical student were when I got to benefit from the generosity of house staff and faculty as they provided me a chalk talk on pathophysiology or just demonstrated compassionate care to patients. And so I recognized early on as a medical student, one of my greatest professional priorities was going to be demonstrating that same commitment to medical education when I became a resident and then later on a faculty member. So going forward, I want to continue to prioritize compassionate care for patients and graciousness towards my colleagues and particularly future generations of trainees like yourselves. So thank you so much again, and congratulations to all the other 22 honorees. Thank you.
All right, I apologize. I was not aware, but Cody Sane also has an intro that he will read for Dr. Stephen Estime, who is one of the faculty honorees, but cannot be here tonight. So, Cody, I'll invite you back up. Sorry.
Okay, part two. So while he was unfortunately unable to join us here this evening, I also have the distinct honor and privilege of recognizing Dr. Stephen Estime from the Department of Anesthesia and Critical Care as one of the 2022 AOA faculty honorees. I've had the pleasure of being Dr. Estime's mentee for the past 3 years, from shadowing in the preclinical years to working on research opportunities to working alongside him in the surgical ICU. As a sub-intern, Dr. Estime's support and teaching has known no bounds. As a prior UChicago resident, Dr. Estime knows the value of hard work, and his commitment to excellent patient care and support of our institution's mission is commendable. As someone committed to advancing diversity, equity, and inclusion in anesthesiology nationally, as well as here in our own graduate medical education, Dr. Estime is truly a rising star in his field, and he's just getting started. On a more personal note, Dr. Estime's presence in our hospital and department as a man of color has been impactful in ways that are hard to describe. In a sense, I feel as though I've been heard and seen on the wards as a trainee, and I'm sure that this sense of belonging is felt by our patients as well. With that said, please join me in virtually congratulating Dr. Estime on this deserved honor.
My apologies for not getting that memo. All right, we will go back to the House staff honorees. So next, we have Dr. Ira Kraft, who will be introduced by Risa Bredney.
Okay, so on behalf of this year's AOA class, it is my absolute pleasure to introduce Dr. Ira Kraft as one of this year's AOA House staff honorees. Many of us had the privilege of working with Ira as third-year medical students. As a medicine pediatrics combined resident, he was everywhere. So members of our class worked with him on adult inpatient medicine, pediatric inpatient medicine, during the MedPeds outpatient elective, and in various combinations of these settings. His ubiquity, while impressive, is not the reason we chose to honor him. Ira's being honored today because in every one of these diverse and uniquely challenging environments, his deep compassion and fierce advocacy for both patients and learners shone through. He undoubtedly improved patient care and enhanced our educational experiences. I was fortunate to work with Ira on both my inpatient hematology oncology rotation and later during my inpatient pediatrics rotation. His warmth and humanism were palpable throughout both. Watching him skillfully form relationships with our patients on the oncology service was inspiring. He navigated painful and difficult conversations with an empathy and kindness that I aspire towards in my own future career. On pediatrics, his patience and approachability made him a cogent communicator, even in the most complex of situations. Most importantly, his commitment to providing equitable and high-quality health care to each one of our patients was unwavering. Beyond being such a committed clinician, Ira was a phenomenal teacher. He was encouraging, extremely knowledgeable, and deliberate in his teaching. He empowered medical students to take an active role in caring for our patients, and he was committed to fostering growth and development in each one of us. I left both of my rotations with Ira feeling proud of my professional growth and with tangible goals for my own continued development. So on behalf of everyone who has worked with and learned from Ira, I want to thank him for being such an exceptional role model. And as we enter residency, we'll all be striving to emulate so many of the qualities he embodies. Please join me in congratulating him on this well-deserved honor.
crying before I even started. Well, thank you. I'm like totally blown away, and I think half of those things are probably true. So, first of all, I'm absolutely, completely humbled and blown away, really, by how many of you guys I've had the opportunity to work with. I want to thank, of course, my wife, my parents, my 6-month-old daughter. They've been my rocks through this. But really, when I found out that I was being nominated for this, I was really, it kind of inspired a time of reflection. And really the big thing that I reflected on, similar to what our Grand Round speaker said today and what Dr. Manning talked about a lot, was this hidden curriculum. And I kind of think about it as a ripple effect. And for me, I really ended up focusing more on the failures than my successes. And I think Dr. Manning did a great job today kind of talking about all those things that inspired her and moved her on. But really, like, I sat there and I thought about the times that I really wasn't as professional as I probably should have been, or I really didn't speak up when I should have, and I went home and couldn't sleep all night because I didn't. And then times when I really didn't feel like I did my best. And I think that in a day like this, where we're all looking at our mentors and our role models, it's really important to remember, too, that we're all fallible, and that's okay. Because the best part of medicine is that every single day you get another opportunity to improve somebody's life that's literally having the worst day of their life. So there's 2 things that I wanted to say just in ending, and the first thing is a quote that was said by Olivia Spencer, who was playing Dorothy Vaughan in the movie Hidden Figures. And that is, just because that's the way it always was doesn't make it right. And I really hope you guys remember that going forward and through residency. It's something that I think about every single day. And the last thing is that, again, while I'm incredibly honored and I don't think of myself as a role model at all, but when we're looking at other people as role models, I really hope that you guys can strive not just to be like your role models, but to grow beyond them.
All right. And our third AOA House Staff honoree is Dr. Mohammed Taha, who will be introduced by Helen Way.
Okay. To lower this? Okay. So it is an absolute joy to be able to introduce Dr. Mohammed Taha as a 2022 AOA House Staff honoree. As many of you know, embarking on clinical training at the beginning of the COVID pandemic is extremely challenging. When I first met Mohammed during my inpatient pediatrics rotation, medical students had to sit in a separate room that had been repurposed for our use. Every day we Zoomed into sign out, morning report, noon conference, rounds. Every day we lamented missing out on the camaraderie and the learning opportunities that were abundant in the maroon workroom. And every day, Mohammed would poke his head into our little room, acknowledging how difficult our situation was and apologizing for not being able to do more. But he always went above and beyond, spending time with us in our workroom and teaching us every day about whatever topics impacted our patients the most on that particular day. Mohammed has always been an outstanding resident, mentor, and friend. But it wasn't until I worked with him in the pediatric ICU during my sub-internship that I realized just how exceptional of a healthcare provider he is. He is so humble, despite being one of the most intelligent people I've ever met. He exemplifies compassion and empathy, demonstrating kindness to more difficult families when the rest of us could no longer muster the energy. On a more personal level, Mohammed was always there whenever I faced uncertainty about my worth as a medical student of color on the team, particularly as anti-Asian hate became more prevalent during the summer. He has absolutely no qualms with vulnerability and role models mentorship in the best possible way whenever I need it the most. Because of Mohammed, I learned the value of being at the bedside, of always asking more questions, and of advocating for the people who need it the most. Mohammed, you're one of my favorite humans. Our entire community is so fortunate to be able to learn from you and be cared for by you. Congratulations from all of us on this well-deserved honor. and we can't wait to see what you're able to accomplish in the upcoming years.
I think it's been a very long time since we were able to take off our masks and speak. And so, like, thankfully I've seen Helen before without the mask. But a lot of people, like, even Daniel, I haven't seen your face. So I'm glad to be able to see people's faces finally. Thank you so much. It means a lot to me, especially because, I just moved here for residency. I didn't grow up here. I don't have any family here. So especially moving during COVID was a big challenge. And the one thing that I really care about is, teaching. That's, even if I don't get recognized for it, which is why I'm very excited to be here today, because I think it's never been in my wheelhouse to be able to be recognized for something, but I still do like doing it because I know that one thing I look back to in medical school is having the resources I need, especially from people higher up in the pyramid. I call it like the hospital pyramid. And the important reason, like the only one thing I want to highlight is everybody's important in a hospital. And I think the time I realized that was, when I was on call and it was very busy, I'm getting paged so many times. I remember walking into a patient's room and I see the cleaner there. The cleaner also has a pager, and the pager went off like 10 times. So everybody is important in the hospital. And if you take time to be a human being and recognize that we're all, like Dr. Kraft was saying, we're all, we all make mistakes sometimes. We all have families to go home to. We are all, we're going to be patients at one point. I think you'll be able to open your heart and have being humble and having the humility to accept when you don't know something, and to listen to people who are, like, most of the time we consider not at the same caliber as us, but that is in fact not true at all, because honestly, most of the time I've learned being a resident is probably from other people, ancillary staff, respiratory therapists, nurses. They know more than you can imagine. And I see this because I graduated in 2018, so it's been a while since being a medical student, but I think I'm learning every single day. And I think that's why we should always keep that in mind when we're working anywhere we go, no matter how high you climb up on that pyramid. Being humble and saying you don't know and listening to other people will make your life so much happier. And you'll be a happier doctor, I would say. Because when you go home at the end of the day, you'll feel like, you know what, at least there are people who, the people who recognize you and have your back for you. And there are times when attendings, unfortunately, made me feel bad, but nursing had my back, respiratory therapy had my back, and it feels very nice to have people advocate for you. That's not just exactly in your line of work, which is being a doctor. So thank you so much for having me here. It means a lot to me, especially from being a brown person from a different country. So thank you so much.
All right, and our last introduction or award is for the Volunteer Clinical Faculty Awardee. It's Dr. Rosara Lisey, who will be introduced by Jorge de Avila. So I'll turn it over to Jorge, who prefers Jorge Luis. I apologize. I knew I was going to get that.
I always say Jorge Luis because I know my mom is watching and she said, I named you. That was the name I was given. Okay. I have the honor of introducing the Volunteer Clinical Faculty Award recipient, Doctora Rosara Lisey. I first met Doctora Lisey in 2018 when I completed my clinical skills longitudinal program at the Cicero Medical Clinica San Lázaro. I had the privilege of observing her treat patients with various needs, from debilitating chronic conditions to acute illness requiring direct admission to a patient experiencing intimate partner violence. I recall the drive home after each clinic. I was full of emotions, many times joy, sometimes sadness, but always hopeful. Doctora Lisey is special. She's special because she touches the lives of so many people every day. In her community clinic, which, by the way, she runs with her brother and a devoted staff. For this reason, I knew I had to go back. I was given this opportunity during my third year. This time she was much tougher. As a clinical student, she expected more of me, to see more patients, to go beyond diagnosing and suggesting treatment plans, but to also integrate community resources in how we actively combat barriers immigrant patients face. I cannot thank her enough for the high expectations she held of me and for teaching me that a community physician has a unique skill set and privilege to advocate for patients, even in the face of structural violence. Doctora Licea went above and beyond to find creative ways to ensure all our patients, regardless of immigration status, receive the care they deserved. She has taught me the most about delivering quality clinical care while being mindful of a person's social circumstances. Without this critical teaching, the evidence-based medicine I have learned thus far will fall short in my future career as a community family physician. Doctora, thank you for your commitment to teaching medical students. You have been a guiding example of the power a community family physician can have in advocating for the most marginalized patients. The Pritzker mission to train compassionate leaders in medicine and science is significantly aided by advocates and role models such as yourself. Congratulations on tonight's well-deserved honor, and most importantly, feliz cumpleaños, happy birthday.
Good evening, everyone. Thank you for this award from the AOA. It's a great honor. I'm grateful for the recognition, and I'm sure that there were plenty of people in the community, other candidates from the community that were much more qualified than me. I'm humbled that you chose me. The inspiration that I have to teach my students and work with my students is what's given me this challenge to myself to be a higher level mentor. It's hard to believe that 20 years of teaching have passed. It's been a privilege to watch my students mature into competent doctors, and sometimes when they carve out a little bit of time from their very busy residency training, it's very rewarding to hear them say, "Just like you said, doctora." I wanted to share a story about a student who rotated with me back in 2017. He was very interested in primary care medicine and really connected with our patients in our community. He shared his reflections about his experience with us and gave me a new perspective back then on my teaching. He wrote about a typical day, which I would categorize as a very crazy, hectic day, and it included a home visit, which he accompanied me on. He experienced this day as impactful and rewarding. When I read his writing, I realized that what I share with my students about patient care is opening up my own story. My story will always include helping students become aware of what a true privilege it is to care for our patients. And I hope that from now on, all of you will pass that on to your students as you become educators. Thank you.
I hope that you can see why tonight's honorees, students, alumni, faculty, and residents were selected. It is just with great honor that we are here to really celebrate all of you, because it's not just academic excellence, as Dr. Polonsky alluded to. It's so much more that brought you here to this table. And as I was listening to all of you, I was thinking about how much I'm learning just every day being the Dean for Medical Education, holding events, interacting with all of you, understanding what it takes to do all of this work, but also caring for patients. I also happen to be on service. And it's in those times when we're with patients that we're better. we are better than we can be. And so I know that all of you, when you go on to your residencies, will remember these days and remember when it's tough and you're tired and you're burned out, but you will rise to the occasion and you will be better too. And so I would like to invite a final round of applause for all of our wonderful honorees tonight. In addition to themes of health equity and social justice, and really thinking about the small, little things that matter to people, that make us who we are, but matter to the people that we care for, I did want to also acknowledge that none of you got here on your own. That's just ridiculous. You would never be here on your own. And whether you have somebody next to you who's your rock, or somebody at home watching on the live stream who's your rock, no matter what age they are or what relation they are part of your world and part of why you are here. And we really want to acknowledge them. And so a big round of applause for everybody who's brought you here. And finally, none of these events get put together by themselves, and certainly I would not be up here if I didn't have a lot of help. And so I do want to acknowledge, in addition to Dr. Golden, we have with us many people who actually contribute to the Pritzker School of Medicine, making it what it is. And so in the back, oftentimes they don't want to get acknowledged, but I do want to acknowledge them personally. We have Kate Blythe, we have Dr. Jim Woodruff, and we have Tyler Lockman with us, as well as many of our student affairs team. So thank you to all of you for helping us. Okay, so without further ado, I know we won't be able to share a meal in person tonight, but we do have grab-and-go dinners for you and your guests that we hope that you will enjoy on the Pritzker School of Medicine, of course. Thank you, Dr. Polonsky. And I know this is also a very, very exciting time in your life as we head towards rank lists as well as match day, and we look forward to supporting you as well as celebrating with you in the many months to come. So congratulations. And thank you, everybody.